Hi, it's Michelle Turner, and I'm here to show you how to check for your rotation. I believe rotation is truly important because that's a key sign that you're in pain. It's because you can't rotate properly. Some of the things that I've been working with, but this is just one way to evaluate. Now I'm in a door jam. The reason I'm asking you to stand in a door jam, because I always want you to, first of all, to be safe. The human system is there to protect you. And if balance is an issue, and that's what happens as we age, is balance can possibly become an issue, even if we don't know about it. And I don't want balance to be an issue with you, so this way, if you're here, you can do things without, even on a subconscious level, to be worried about it. Because guess what, if you're worried about balance, then you're going to protect the balance first before you can evaluate yourself. So in this kind of circumstances, and by the way, if you're a professional, you can do this with someone else by putting them into a jam and talking them through it like I'm doing with you. First of all, if it's uncomfortable in any way, shape, or form to put your arms up like this, then don't do it. If you need to, I'll show you at the second part how to do it with your hands down here, but for now I'm putting the hands up here. But just this shoulder rotation, for some, again, it's that rotation that's starting to be compromised, could cause discomfort, and this isn't about discomfort, this is just about evaluation. So looking straight on, like this, again, if this is comfortable, I want you to look at each one of your hands, separately of course. So you're just gonna go this way, so what I want you to do is to look at your hands, separately of course, but in this position. So first, you're just going to look, let's say, over to the right, and just feel, again, is there any pain? Because, and that's when you can start seeing where your rotation is off. This is what this evaluation is about. And now look at the other hand. Now, also notice, are you doing this relatively the same way? Or do you literally have to move your feet to look at this hand? Because again, then you're taking away from the rotation. So can you look at this hand and then at this hand? And then again, that's that simple left and right. Guess what? This is driving, folks. This is looking around at the malls. This is, this should be an easy activity. And if it's not, I'm not saying fix it because you don't know how. This is just an evaluation, but something to look at saying, oh, I didn't realize I wasn't doing this anymore. So now in the same position, just go stable. And what I want you to do is look down at your feet. Now most people are just going to go like this straight down. But I purposely want you to look at either the right foot or the left foot. So again, with your hands at the jam, you're just going to look down at the right foot. Now notice I have to twist over myself a little bit to do that. And look down at the left foot. And again, first of all, can you do it to both sides? And that's what I'm doing now. I'm going from left to right. And is it easy from both sides? Is there any pain? So now a more complicated one, if those are okay, and if they're not, just stop and we're going to go to the second part. Go down, look at your left foot, and then very slowly I want you to look at the right corner of the jam. So my eye attention is right up here. And again, look back at my left foot and back at the jam. Again, is that easy to do? Are you holding your breath? Are you clenching the walls now? Look at those things. Now go down and look at the right foot and up at the left corner. And again, my tension's up here and back down and the corner. Now, more complex to look at, but if you're doing those, you should be fine, is to actually twist like I'm looking at my right hand and then bring my eye up the wall up until here. So see, my twist is much more pronounced than just here to here. Some people might be just doing that with their heads. So you're actually looking to twist to look at the hand and go up. And now look at the other hand and go up the jam. So it's like you're watching a little mouse go. And the most complex is to look at the hand, go up to the corner, all the way over to the top, and then down at the hand. And this is where you're going to catch the glitches in your rotation in your upper neck, rotation through the pelvis. And guess what? This is a great little practice for your balance. Go here, here, I can go from this corner now down to that corner. I can see if I get a little quicker at it. Do I move my tush a little bit more? You know, working with that rotation. So now, I said before, if this hurts, putting the hands down here. Now you can either put it this way, where your fingers in front, or behind. That's not the point. So in this way, I want you to just look left and right and just see what that's like. And again, at any time if you need to rest, sit down, please do. You know, it's not about, you know, how fast and how quick can I do it. If you don't feel good, sit down. And now look down at this hand and look over at this hand. And again, are you just doing it with the head? What I'm looking for is the actual, see how my tush is rotating to look at the hand. And at the same time too, now look at the left foot and then come back here. Now if you're not sure where to look, it's off your shoulder height. Put a little sticker here or something that if you need eye contact. And go down and go back up. And now from the right foot over to the left side. Same thing from here. Now I can go up to the corner and back down. Notice how my back extends to do it. Again, I'm not just throwing my neck over and up, and then eventually up and over. All of those things should be without pain. If you're in pain, there's issues with the rotation, so how your foot, if this hurts, let me tell you, getting in and out of the car hurts, because when you're sitting down and you're going into the car, you need to rotate. You know, getting out of the car shouldn't be, you know, a 4-point shuffle. You need to bring your foot out and rotate and get out. That's getting in and out of a booth. All of these things, you shouldn't be holding your breath. That's another thing that either you don't know how to do the movement's getting poor, or again, you just don't know how to do the movement, so you're holding the breath to protect yourself. So just notice if you're glitching your teeth. Notice if you're grabbing onto the jam versus just an easy touch. I wasn't holding on for my dear life. Now again, if you're someone that's been working with a walker, I can tell you your rotation's off, so you don't need to do something like this. But if this is something, again, that you're noticing the back or the lower legs, you're not sure where the pain is coming from, you know, if your knee can't rotate, something like this is a nice little evaluation to do to see that I have issues with the knee. And then you can go to a movement specialist to work on that, because guess what? Can't take a pill. In most cases, can't do surgery for mobility issues. If anything, they will, again, you already have a limited range of motion. You're doing something that's going to, again, decrease that range of motion. Now, if you're bone on bone, your appendix needs to be taken out, I get that. But if you're actually having mobility issues, look first to see about working with the movement specialist to work on your mobility versus trying to fix a part. You know, and again, it's just the way people go to school. This is a school I've gone to, and that's what I do. But, you know, other people have different thoughts. I get this. I would give it a try. So, check your rotation. Thanks.